Hello everyone and welcome to our channel Physiosaurus. In today's video I'm going to be talking about the knee flexor group of muscles. Okay, so the flexor group of muscles in the knee joint has 7 muscles and they are all posterior located. Alright, so these 7 muscles are your semimembranosus, semitendinosus, biceps femoris, sartorius, gracilis, popliteus and the gastrocnemius. Alright, so the first 3 muscles are together known as your hamstring muscles. Alright, so hamstring is a flexor group of muscles. Now plantaris is the another 8th muscle which can be or cannot be present. Alright, now except the short head of the biceps femoris and the popliteus muscle, all the muscles are 2 joints muscle. They either crosses the hip joint or they either cross ankle joint. Alright, so the biceps femoris has 2 head, the long head and the short head. Alright, so except the short head of the biceps femoris is a part of hamstring muscle, and popliteus, alright, the 6th muscle, all the muscles are 2 joint muscle. So except these 2, the rest of the muscles are your semimembranosus, semitendinosus, long head of biceps femoris, sartorius, gracilis and the gastrocnemius. And if plantaris is also present, then the plantaris would be the 8th muscle. Now let's talk about the function of these muscles in detail. Alright, so the popliteus muscle, gracilis muscle, sartorius, semimembranosus and semitendinosus muscle, it medially rotates the tibia on the femur. Okay, there is nothing to understand but just to remember. Alright, and the biceps femoris muscle, it laterally rotates the tibia on the femur. Okay, then there are lateral muscles which are your biceps femoris, lateral head of gastrocnemius and popliteus muscle. They produce valgus movements, okay, of the tibia on the femur. And there are medial muscles which is your semimembranosus, semitendinosus and medial head of the gastrocnemius. So gastrocnemius has again 2 head, medial head and the lateral head. Lateral head produces the valgus movement, okay, don't confuse between them, and the medial head of gastrocnemius, they produce varus movement. Okay, so what are the muscles which produce the varus movements? So sartorius, gracilis, semimembranosus, semitendinosus and the medial head of the gastrocnemius. Okay, again I have written that the hamstring has 3 set of muscles which are your semitendinosus, semimembranosus and the biceps femoris, long head and the short head. Now let's talk about the attachment of these muscles. Alright, so first we will talk about the hamstring muscle. So hamstring attaches proximally to the ischial tuberosity of the pelvis except the short head of biceps femoris which has proximal attachments on the posterior femur. So all the muscles in the hamstring attaches proximally to the ischial tuberosity of the pelvis. Okay, I'll highlight this, ischial tuberosity of the pelvis, except the short head of biceps femoris which is proximally attached to the posterior femur. Okay, now let's talk about the distal attachment. So distally, the semitendinosus muscle attaches to the anteromedial aspect of the tibia to pes anserinus. Now I have already discussed about what is pes anserinus, so you are going to tell me in the comment section that what is pes anserinus. Okay, now semimembranosus muscle inserts posteromedially on the tibia. So basically in the first point I was talking about the proximal attachment. Okay, every muscle has a proximal attachment and the distal attachment. So in the first point I said that except the short head of the biceps femoris muscle, all the muscles in the hamstring attaches proximally to the ischial tuberosity of pelvis, but short head of biceps femoris proximally attaches on the posterior femur. Now I am going to talk about the distal attachment. So semitendinosus muscle attaches distally to the anteromedial aspect of tibia. Okay, semimembranosus muscle attaches posteromedially on the tibia, okay, and biceps femoris, both head of the biceps femoris, your long head and the short head, they attaches distally to the head of fibula through lateral tibia. Alright. Now, the short head of the biceps femoris doesn't cross the hip joint, which I have already said, okay, that here I have written that except the short head of the biceps femoris and popliteus, all are two joint muscle, okay. So, except the short head of the biceps femoris muscle, which does not crosses the hip joint, all the muscle crosses the hip joint, okay, and in the hip they are the extensors, okay. So, hip extensors, they are the hip extensors, and in the knee they are knee flexors. Alright. Now, the next point is a very important point, so that's why I have added it as a note, okay. So, greater hamstring force is produced when the hip is in flexed position. Why? Because the hamstring are already lengthened. Now, just right now I have said that rest of the muscles except the short head of the biceps femoris, rest of the muscle crosses the hip joint, okay, crosses the hip joint as extensors, okay. So, the hamstring is also a extensor, hip joint extensors, okay. But when you will perform the hip flexion, at that time the hamstring will become the antagonist muscle to hip flexion, okay. So, during hip flexion the hamstring will be lengthened, okay, hamstring will be lengthened, elongated, okay. So, when the length of a certain muscle is increased, that means that muscle has to produce more force, greater force than the normal to produce the movement. So, that is why when you will perform the hip flexion, at that time greater hamstring force is produced. Why? Because the hamstring muscle are already lengthened, okay. Now, the next point, hamstring produces less force as the knee flexion approaches the maximal shortened position, that is known as active insufficiency. So, basically when the knee flexion will approach the maximum shortened position, at that time the hamstring will also contract maximally, okay. So, at that time the hamstring will produce the least force, it cannot contract more, okay. So, when the knee flexion approaches the maximal shortened position, at that time the hamstring will be contracted maximally, and that will be known as active insufficiency, because at that time hamstring will produce less force and at that time it could not contract more, okay. Now, at the same time, when the knee flexion has approached the maximal shortened position, at the same time rectus femoris, which is a part of quadriceps muscle, it will be lengthened, okay. So, due to its lengthening there will be an increased tension in the rectus femoris muscle, okay. So, at that same time hamstring should overcome the increasing tension in the lengthened rectus femoris, because the because the rectus femoris is a antagonist muscle to the hamstring muscle, okay. So, when hamstring muscle will be in the shortened position or in the shortened state, okay. So, at that time the rectus femoris will be lengthened and that will lead to increased tension in the rectus femoris muscle, okay. So, at the same time hamstring should overcome the increasing tension in the lengthened rectus femoris muscle, because it is approaching in the state of passive insufficiency, okay. I will just repeat whole of this paragraph again so that you don't have any confusions left, okay. So, first let me erase this, okay. So, the first point was greater hamstring force is produced, okay, greater hamstring force is produced when the hip is in flexed condition. Why? Because the hamstring is already lengthened. Second point was hamstring produces less force as the knee flexion approaches. Okay, as the knee flexion approaches the maximal shortened position, and that is known as active insufficiency. Okay, and at the same time the hamstring should also overcome the increasing tension in the lengthened rectus femoris. Okay, lengthened rectus femoris, as it is reaching the passive insufficiency. Just keep these three things in your mind. Now let's move on to our last line in the hamstring group of muscle. Okay, so in non-weight bearing position, hamstring produces a shearing force in the posterior direction, okay, of tibia on the femur. So basically, non-weight bearing position means when you, let's take an example that when you sit on a chair in the high sitting position and then you try to flex your tibia on the femur. Okay, that is an example of non-weight bearing position. So in that same position, the hamstring will produce the posterior shearing force. Okay, and it increases with the knee flexion with maximum between the 75 degree and 90 degrees range of motion of knee flexion. Alright. So basically, with increasing knee flexion, this posterior shear force increases, okay, and it is maximum between the range of motion of 75 degree and 90 degree. Hamstring contraction reduces the strain on the ACL ligament, but it increases the strain on the PCL ligament, and it was the exact same thing which I was talking about in the video of ACL ligament. Okay, in that particular video I said that the hamstring is a friend of ACL, and now you understand why. Okay, now the second group of muscle, which is your, not a group of muscle but a single muscle, which is your gastrocnemius. It is a part of your calf muscle. Okay, so it originates by the two heads from the posterior aspect of your medial and the lateral condyle of the femur, and it attaches distally to the calcaneal tendon. Okay, you tell me in the comment box that what is the other name of the calcaneal tendon. Okay, it is again a two joint muscle. It crosses the ankle joint and the knee joint. All right, it weakens as a knee flexor when the ankle is plantar flex. So basically, when you plantar flex your ankle, at that time it weakens as a knee flexor. All right, now when your knee joint is fully extended, then gastrocnemius produce maximum knee flexion torque. Okay, and with increasing knee flexion, the torque is reduced or decreased. Okay, now let's talk about our third muscle, which is your sartorius. Now sartorius arises anteriorly from the ASIS, which is your anterior superior iliac spine. It crosses femur to insert into the anteromedial surface of the tibial shaft. All right, as a knee joint flexor muscle and as the medial rotator of the tibia, and during gait it is active during the swing phase. These are the actions of the sartorius muscle. Okay, so it works as a knee joint flexor muscles, it works as a medial rotator of the tibia, and it during the gait cycle it is the active muscle during the swing phase. So these are the actions of sartorius muscle. The next muscle is your gracilis. Okay, it arises from the symphysis pubis and attaches distally to the pes anserinus tendon. Okay, let's talk about the action of these muscles again. So it acts as a hip flexor and hip adductor, knee flexor, and medial rotator of the knee. Okay, medial rotator of the tibia on the femur, you could say that. Okay, now three muscles of the pes anserinus resist the valgus forces, and it provides dynamic stability to the anteromedial aspect of the knee joint. Okay, so as I have already discussed before that pes anserinus is a common tendon. Okay, common tendon of three muscles. What are those three muscles? I don't know if you guys remember it or not, but those three muscles were semitendinosus, gracilis, and sartorius. Okay, So I have already talked about this sartorius and the gracilis and semitendinosus muscle. Semitendinosus we have discussed about that in hamstring part. Okay. So these three muscles of pes and sarinus, it resist the valgus forces. Okay. And it also provide dynamic stability. Dynamic stability means when you walk. Okay. It provides dynamic stability. So it basically provides the stability when you walk to the anteromedial aspect of your knee joint. Alright. Now let's move on to our fifth muscle, which is your popliteus muscle. It is the small single joint muscle that attaches to the posterolateral aspect of lateral femoral condyle. Okay. Then it goes inferiorly and medially to attach to the posteromedial surface of proximal tibia. Alright. Nothing to understand here, just to remember everything. Okay. Now it helps unlocking the knee by medially rotating the tibia, but in final stages of flexion. Okay. Why? Because unlocking of knee is an automatic phenomenon. Why am I saying that? So basically, when I was talking about the unlocking of the knee, in that particular video I said that the unlocking of knee is an automatic phenomenon. Okay. There is not even a single muscle which is responsible for the locking and unlocking of knee. Okay. And right now I am saying that it helps unlocking the knee. So it's kind of a contradictory thing. Okay. So that is why I am adding, not I am, it is given in the Cynthia Norkins. Okay. So it helps unlocking the knee by medially rotating the tibia, but in the final stages of flexion. Okay. So medially rotation of the tibia happens in the early stage of flexion. Okay, before the flexion begins. But here I am saying that it helps unlocking the knee by medially rotating the tibia, but the difference is that it happens in the final stages of flexion. So it kind of helps unlocking the tibia in the final stages of flexion. Okay. Why? Because unlocking of the knee is an automatic phenomenon. Now let's talk about our next line, which is your during early flexion, popliteus muscle deforms the lateral meniscus in the posterior direction. Okay. Deforms means it kind of changes the shape of lateral meniscus. So the next muscle which I am going to be talking about is your soleus muscle. Okay. So soleus muscle do not crosses the knee joint. First point. Then the attachment. So it attaches proximally to the posterior aspect of proximal tibia and fibula and distally to the calcaneal tendon. Alright. Soleus muscle also assists in the knee extension. Okay. Now the next thing is soleus muscle assists the hamstring in restraining excessive anterior displacement of the tibia. Now the last muscle, which is your gluteus maximus muscle, it assists the knee extension in the weight bearing position. First thing, it do not cross the knee joint. Second point, it also act as hip extensor. Third point. Fourth point, it produces the anterior shear force of tibia that would increase the tension in the ACL, because the work of the ACL was to restrain the anterior shear force. Okay. Or to stop or to restrain the anterior translation of tibia on femur. Okay. So since it will produce the anterior translation of tibia on femur, then it would also increase the tension in the ACL ligament. Alright. And now the last line is when the foot is flat placed on the ground, okay, with foot flat on the ground and knees a little bent, at that position contraction of the glutes muscle will create a knee extension and ankle plantar flexion. So basically if you will look at this diagram here, the knees are little bent or flexed. Okay. And the foot is placed on the ground, foot flat. Alright. And this one here is your gluteus muscle. So when the gluteus muscle will contract, it will kind of pull the knee in the backward direction. Okay. In the backward direction, and that will create extension of the knee joint. Extension of knee joint. Same thing will happen with the soleus muscle. This one here is your soleus muscle. So when the soleus group of muscle will contract, it will again pull the tibia in the backward direction, and that will lead to extension of the tibia, which I was discussing just right now. Okay, that soleus assists in knee extension and it assists the hamstring in restraining excessive anterior displacement of the tibia. Okay, that's the same thing. So this is it. This was all about the knee flexor group of muscle. Okay, so in the upcoming video or the next video, I'm going to be talking about the knee extensors. Okay, knee extensors. So thank you so much for